I'm Madison Adams, and this is my head-to-toe assessment with my patient, Amanda Holland. First, I'm going to wash my hands. Hi, Amanda. My name's Madison. I'm going to be your nurse today. Can you tell me your name?
Amanda Holland,
And your birthday?
March 23rd, 1990.
Do you know where we are?
Yeah, Kinnison Hospital,
Okay, and what year is it?
2015.
Amanda is alert and oriented. She's following my commands and answering my questions, so we know that her GCS is 15. We've previously done her vital signs. Her blood pressure is 120/80. Her respirations are 18. She has a radial pulse of 75, and her O2 saturation was 98%. Now, Amanda, I'm going to be doing an assessment on you. I'm going to be a little hands-on. If at any point you feel uncomfortable, please let me know.
Okay.
Okay? So first, I'm just going to take an overall appearance of your skin. You look pretty healthy. Let me see your hands. Okay. Her skin is warm and dry. No tinting, so she's well hydrated. Her nails are clean and groomed. They are painted. No evidence of clubbing. She has good capillary refill. I'm going to take a peek at her legs. She has equal skin coloration. No discoloration is noted. She has good cap refill in her toes. And no pitting edema, so that tells me that she has no vascular disease. Okay. Alright, next, Amanda, I'm going to assess your head. I'm going to be touching and feeling, see if you have any kind of bumps or lesions in your head. Okay? So now I'm feeling for her head to see if she has any trauma or anything noted to her head, which I do not feel anything. Everything seems to be within normal limits. Her hair is full and it has equal distribution throughout her head. Okay. Now, Amanda, I'm going to assess your eyes. Okay?
Okay.
I know from our previous conversation that you do wear glasses, right?
Yes.
Okay. So I'm going to shine a little light in your eyes. Just look straight at me. Her pupils are about 4 centimeters. They're equal, round, reactive to light, and accommodation. I'll just follow my finger, okay? Okay. Look directly at my finger and follow it all the way into your nose. Okay, now I'm going to test your peripheral vision. Let me know when you see my finger come into sight.
Yeah.
Okay?
Yeah.
Great. With those tests, I tested her optic nerve, which is cranial nerve 2, cranial nerve 3, the ocular motor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. Okay. Now, Amanda, I'm going to be touching on your face and feeling your sinuses. Are you currently having any kind of sinus pressure, any colds or anything? Okay. Any pain here? I'm going to go ahead and feel your jaw here. Open your mouth for me. And move your jaw side to side. Okay. Amanda does have TMJ, so we know that her trigeminal nerve or cranial nerve 5 is intact. Her sinuses are intact. I felt no moving or pressure or anything in her sinuses. Okay. Next, Amanda, I'm going to test your ear. Okay? Do you have any hearing problems that you know of? I'm just going to feel your ears. And while I'm feeling her ears, I'm going to go ahead and assess her lymph nodes. Pre and post auricle. Down into the cervical, submandibular, the deep cervical chain, and the subclavicular. Okay. I noticed that her ears are pierced. She has no hearing deficits. Her lymph nodes are within normal limits. I did not feel any masses. And I'm going to test her hearing now. So, Amanda, I'm going to whisper a word to you. Please repeat the word that I whisper.
Cat.
Okay.
Ball.
Okay, great. So she was able to hear me when I whispered to her, so that lets me know that her acoustic nerve or cranial nerve 8 is intact. Now I'm going to assess her temporal arteries and her carotid arteries. Just going to palpate them right now. They're good and strong. Carotids are intact. And now I'm going to palpate her thyroid. Please swallow for me. Okay, great. I don't feel any masses in her thyroid. Her carotids are good and strong, and her temporal arteries are good and strong. Okay, now Amanda, I'm going to assess your mouth, okay? Open your mouth for me and stick out your tongue. I'm going to shine a light in your mouth. Great. Her mucous membranes are pink and moist. Her teeth look all intact, and her tongue is within normal limits. Now, Amanda, please say "ah" for me.
Ah.
Okay. Her uvula had a nice rise and fall when she said "ah." It did not deviate to one side or the other. While I was looking at her thyroid, I did notice that her trachea was in the midline position, so there's no abnormalities there. While, Amanda, can you smile for me? Puff your cheeks out. Okay. And while she said "ah," smiled, and puffed her cheeks out, I tested her number 7 cranial nerve, the facial nerve, number 9, the glossopharyngeal, number 10, the vagus, and number 12, the hypoglossal. Okay? Amanda, can you shrug your shoulders for me against my hands? Okay? Now push my hand away. Do the same here. Okay? That test tested her number 11 cranial nerve, the accessory nerve. Okay, are you okay with that?
Mm-hmm.
Okay, great. Now we're going to move on. I'm going to be listening to several things at one time. I'm going to go ahead and assess her temporal arteries, her carotid arteries, and then I'm going to kind of move into the respiratory and the cardiac assessment all at one time. Okay? When I get to the respiratory assessment, I'm going to ask you to take some deep breaths in and out. I'm going to have you do it several times. If you feel like you're going to hyperventilate or get dizzy or lightheaded, please let me know. And we can stop, okay? Now I'm going to listen to her temporal arteries. Her temporal arteries are nice and strong. And now the carotids. Hold your breath for me. Okay, you can breathe. Hold your breath. And breathe. Her carotids are nice and strong. And I'm going to listen to your thyroid. And please swallow. Great. No abnormalities are there. Now I'm going to move into the respiratory assessment. Take a deep breath for me. Once more. Okay, that was the posterior respiratory, which she sounds clear. Now I'm going to move to the lateral respiratory. Deep breath. Once again. Okay, and now I'm going to listen to her heart. Just breathe normal for this part, okay? No murmurs, rubs, scallops, or clicks are noted. I'm going to listen to your heart one more time. I compared her radial pulse with her apical pulse, and I see no differences there. And her heart rate is about 75 times a minute. Okay. Now I'm going to listen to her posteriorly for her respiratory. Deep breath for me. You doing okay?
Mm-hmm.
Okay. One more breath. As I listen to her respiratory efforts, her lungs are clear all the way through the bases, equal on both sides. Her respiratory rate is about 18 times a minute. I don't see any distress noted. She has equal rise and fall of the chest, and her chest is symmetrical. There's no barrel of the chest or anything like that. So her respiratory and cardiac-wise, she seems to be within defined limits. She had normal S1, S2 heart sounds. And like I said, she had no murmurs, rubs, gallops, or clicks that I noted. Okay, now Amanda, I'm going to feel your pulses and just make sure that everything's okay with your pulses, okay? Okay. Check her radials. Radials are +2 bilaterally. We've already assessed her temporals and her carotids, and we know that they are +2 bilaterally. Brachial. Good, +2 bilaterally. Popliteal's good, +2 bilaterally. Good. Posterior tib, +2 bilaterally. And pedals are +2 bilaterally. Earlier we noted that she has no pitting edema or anything, so that we know that she's intact vascularly. Okay, next I'm going to move on to the abdominal assessment. So Amanda, if I could have you lay down for me. And I know from our history that you do not have your appendix.
Mm-hmm.
You have no liver disease, and you still have your gallbladder, correct?
Correct.
Okay. Any pain in your abdomen at all?
No.
Okay, great. So I'm just going to listen, and then I'm going to do some palpation, okay?
Okay.
So she does have bowel sounds present in all 4 quadrants. Now I'm just going to do some palpation. Her abdomen is soft and non-tender. It's not distended. Take a deep breath in and blow it out. Her liver is within normal limits. I feel no signs of ascites or anything like that. Okay. Now I'm going to have you sit up. Just sit on the side of the bed. Now I'm going to teach you how to do a self-breast exam when you're in the shower, okay? The best time to do this is about a week after your menstrual cycle. And you just want to check, get to know your breast and know to see if you can find any abnormalities within yourself. If you do find anything, just something that feels out of place, any hard bumps or anything, you would definitely want to go get it checked out, okay?
Okay.
So I'm going to demonstrate to you how to do it, and then I want you to return it back to me. And feel free to ask any questions. Okay? So you're going to get in the shower, really hot, steamy shower. Place one arm behind your head. And then just take fingers and go around your breast in a circular motion. And you're going to work your way into the nipple line. And see if you find any bumps or lesions, anything's painful, any nodules, or anything like that. And work all the way into the middle. Okay?
Okay.
You think you can do that for me?
Mm-hmm. Behind my head,
Mhm.
hot steamy shower,
Mhm.
1 week after menstrual cycle. Just work my way around into the nipple line.
Good. Another way that you can do it is you can put one arm behind, and then you can also go diagonal across your breast like this. It's good to do both, that way you don't miss anything. Great job. Great. Okay. Now I'm going to test your reflexes. Okay. Do you have any problems with your reflexes that you know of?
No.
Okay. So just let your knees hang. Let it hang. Relax. Okay. Her deep tendon reflexes are, her patellar reflexes is intact. I'm just going to let your arm fall. Okay. Okay. All of her reflexes are intact. Okay. Now I'm going to test your neuromuscular status. Okay. You have told me your name. She does know what year it is. She does know where she's at. She has been following commands through the whole entire assessment. So we know that her GCS is 15. Okay. Now, Amanda, can you take your index finger and touch your nose? Touch my finger. Touch your nose. Touch my finger. Can you do it with the other hand? Great. Okay. Now I'm going to get you to flip your hands back and forth on your lap like this. She is able to do that so that we know that her coordination and she's able to follow commands, so we know all of that is intact. All right. Amanda, I'm going to put an object in your hand. Please close your eyes and then tell me what the object is, okay?
A paperclip.
Okay, great. Now, let me see the other hand.
A piece of cloth.
Okay, great. Okay, now I'm going to do one more test. Please keep your eyes closed. I'm just going to look in your nose real quick. Her nares do seem to be intact. I'm going to wave something in front of your nose. Please tell me what you smell.
Alcohol.
Okay, great. She was able to identify the smell of alcohol, which that lets me know that her cranial nerve number 1, her olfactory nerve, is intact. Okay? Amanda, please keep your eyes closed. Or close them again. Now hold out one hand. I'm going to draw something in your hand. Please tell me what that is.
A 3.
Okay? Now let me have this other hand. Keep your eyes closed. I'm going to draw something else.
A 5.
Okay. She is able to tell me what I draw in her hand. So that tells me that she's intact neurologically. Okay. Now I'm going to take an object and I'm going to touch you on your arms, your face, and your legs. And you tell me whether it's sharp or it's dull.
Okay.
Okay? Ready? I'm going to do your face first, so I don't want you to freak out, okay?
Okay.
Alright.
Dull. 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 Sharp. Dull.
Okay. Now I'm going to move down to your arms.
Sharp. Dull. Dull. Sharp. 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 Dull.
Her sensation is intact because she was able to distinguish between a sharp and a dull point. Okay? Now, just going to get you to test your strength.
Okay.
Okay? We've already had her shrug her shoulders and push her hand against gravity, so we know that her accessory nerve is intact. So, squeeze my hands. Tight, tight, tight. Okay? Push my hands away. Okay? Now pull me towards you. Great. Step on the gas. Okay? Pull your feet up. Okay. Push your legs against me. And now pull against me. Okay. She does have equal strength bilaterally in her upper and her lower extremities. Okay. Now, I'm going to get you to put your shoes on real quick for me. And stand up. Great. I'm going to just look at your spine and make sure that everything's okay. So that if you'll just bend over at your waist for me. Her spine is in nice alignment. I don't see any abnormal curvatures or anything, so her spine is good there. Okay. Stand up for me. You able to stand on one foot?
Mm-hmm.
Okay. Great. Her balance is intact. Can you do it with the other foot? All right. Once again, her balance is intact. Okay, Amanda. What I'm going to get you to do is just walk over toward that sink. Sorry. In a heel-to-toe fashion. So heel-toe, heel-toe. Great. Balance and coordination, once again, is intact. All right, Amanda, while you're over there, I'm going to get you to look right here at this eye chart.
Okay.
Okay. We do know that Amanda wears glasses, and she has her contacts in right now.
Mm-hmm.
So, Amanda, can you please read this line for me?
EDFCZP.
Okay. Can you read the one below it?
Yes. FELOPZD.
Okay, great. And do you think you can read in that last one?
DEFPOTEZ.
Okay, great. Okay, you can have a seat for me. So we know that Amanda does wear glasses, so her vision is about 20/25. Okay. Do you have any questions for anything, Amanda?
Mm-hmm.
Okay, great. So this is my head-to-toe assessment.